Hello, everyone, and welcome to the Brownstone. I'm your host, Dr. Michele, and you are listening to Numbers Don't Lie, where you learn to get out your feelings so you can make the best decisions for yourself, your family, and your business. Well, guys, I have a really special guest today, another doctor in public health, huh? It's two of us on the show at the same time. So you definitely in for a treat. We're going to be talking about data, of course, but nonprofits and public health it's gonna all be meshed in there together because nonprofits and public health really are married. I know I said about like data and grants, data and marketing, but it's another one of those things where they really go hand in hand because a lot of our nonprofits, they're doing the work that the government isn't doing, and that even larger institutions aren't doing. So they are, educating our children, they are feeding the homeless. It's so many things that they're doing, and that all is a part of public health. So my special guest has a nonprofit herself, but we're going to talk from a lens of Black data professionals in public health. I met her at a nonprofit conference, and she's just as much a rock star as me. Toot toot. So welcome to the Brownstone, Dr. Jasel.
Hi, Dr.
Hey,
Michele.
Dr. Jasel.
I love that our names rhyme, by the way.
Oh, we're meant to be friends. That's all that means.
The first time you spoke, I was just like, I love her. She's amazing.
Likewise.
Oh, man. I'm so happy to be here. Thank you so much for the invitation. I can't wait to have this conversation and let these people know about data. And it's not scary. I promise. It's not scary.
It's not. So, Dr. Jasel, could you tell them a little bit about who you are? Like, how'd you get here?
Oh, okay. So I'm going to give you the abbreviated version. So I'm a doctor of public health with a focus in health education and prevention. I'm also a clinical exercise physiologist and an epidemiologist, as well as a clinical nutrition specialist. So I'm a mom, I'm a daughter, I'm a friend, I'm a mentor. I do a lot of things, as many of us Black girls do a lot of things, but I have a passion for public health for very personal reasons,
Mm.
um, most of which really stemmed from childhood. Like I experienced what it was like, and not even just in my immediate family, but cousins and different things. I was exposed to extreme poverty. I had family members who lived in the hood. I had a cousin who was killed playing football, um, just playing football and having fun with friends, just being a teenager. My father died of diabetes complications. One of my mom's younger brother died of a brain aneurysm after losing weight. Like all of these different things that are so stigmatized to our community, these things are they have impacted me directly. And I'm thankful for them, even though they were painful. And I know it takes a lot to say, but I'm that much more even empowered to create research, to create programming, to partner with other organizations that are passionate about addressing this so that other families don't have to go through the things that I've experienced, that other people I love have experienced. And so that's my story, and that is my why. And also, I don't want my child and other children like her to grow up having to experience these things. So there's so many more things I could say, but I'm going to stop there.
That's good. I'm so sorry for your losses. And it's probably taking a turn, but like those things it doesn't get easy with the next person. You know what I mean? Like our family had a string of back-to-back years, and it's just like it literally does not get easy. You don't get used to the feeling of losing someone. And I love that you are in prevention as well, because that was my focus. Like first I wanted to do like HIV, but then I was
Mhm.
like, well, I want to move it to something that's a little more, I don't say, I mean, that's preventable too, but I want to move away from viral infections into things that touch us just so commonly in the Black community: diabetes, heart disease, I mean, I would say high blood pressure runs in my family, but it stops with me, child. I have a really great blood pressure. I take care of myself. But it really is just like very practical things that we can do. But a lot of times our community either doesn't know about or doesn't know how to practice it in real life. So I love that you're in prevention as well. And you have like 45 degrees in certification. So how long were you in school?
So the Lord was good to your girl. He was good. Thankfully, honestly, I've always been really academically savvy. And I actually graduated high school when I was 16.
Wow.
Um, I graduated from college when I was 19. And so I have a bachelor's degree in biology with a minor in chemistry. I have an MBA in healthcare administration. I also have a master's degree in exercise physiology, and then I have my doctorate in public health. So I do have 4 degrees that are earned. They were not credited, they were not honorary. I went to school and paid for the mugs. And then I have a lot of certifications, um, a lot of them through the through ACSM, American College of Sports Medicine. I'm actually certified to work with people who have different comorbidities like cancer and diabetes and all kinds of other things. I am I'm actually getting ready to become a licensed dietitian as well. So I'm a candidate right now, finishing all of my little supervised hours. Once I finish that, I'm done. Um, so
Where do you find time to do all this?
This is a good question. I feel like when what you do for a living and what your purpose is, your God-given purpose aligns, I feel like it just fits into my schedule because these are things that I genuinely enjoy. They genuinely bring me joy personally. And yeah, it takes some dedication. I'm not gonna lie, but
Yeah.
it gets done.
Well, I love that. So now people won't think I'm the busiest person in the world.
You can, and I believe in work-life balance. I go out with my girlfriends. You spend time with my daughter. I do all the things. I'm a big proponent of self-care. I have my little massage appointments, everything. If there is a way, it's just a matter about what you prioritize in life. You know,
No, I
put down
love
the
it.
phone, stop scrolling. So
You can buy some, you can get some time back to put your phone down. Is that what you're saying?
absolutely.
I love that. And I'm here for it. So, at the conference, I mentioned how I said nonprofit work is public health. Like, how do you see nonprofits fitting into like the larger picture of public health?
Well, that is such, when you said that, I thought it was so profound. And I honestly had never heard anybody say it that way, but you're absolutely right. Because honestly, almost every single nonprofit I have worked with or I'm familiar with, whether it's super large and they have a multi-billion-dollar budget, or they're super small and they're just starting up,
Mm-hmm.
they all work within to address some form of social determinant of health or one of the 8 domains of well-being as a person. All of those things fall under public health.
Yeah.
And so I thought it was very insightful for you to say that because, and just for the people who are listening and watching, social determinants of health are basically the conditions in which people are born, how we grow, how we live, how we work, how we age, just the entire lifespan, and all of the different things, factors that impact the quality of those things. They include all the social economic factors like social economic status, your education, where you live or your neighborhood, your physical environment. Do you have sidewalks? Do you have streetlights? All of those things. Employment.
Like
Right.
when I say I pay attention to that so much, I'm like, this doesn't make any sense to have any sidewalks. It's so residential. There's so many stores, like there's hotels where people live. Like, why don't they have like I'm mad about the sidewalk thing, okay?
It's girl, it wasn't until I was doing my postdoc in Baltimore and I was canvassing different neighborhoods, just getting to know them. As a Black researcher, I need them to know, like, hey, I'm a researcher, but I care about y'all. So I would literally walk the neighborhoods door to door. Hey, hi, I'm Dr. Martin. I would just introduce myself as Jasel. I am a normal human being. I want you to get to know a researcher from a different lens. And I'm walking out there, there's no sidewalks. We're in Baltimore. We're not in Texas. We're not in some suburb. We're in Baltimore City. And I'm sitting here like trying not to get hit, just
Girl.
going door to door. And I'm like, how does
And
the
don't let
world
them not
feel
mow the
here?
grass. Now you got to walk in these tall weeds. I see it all the time when where I live. Like to me, it's a heavily residential bus stops and children, riding a bus, and it's people that are walking street slash grass. I'm like, this is so dangerous. But
Mhm.
anyway, sorry, y'all, we got on a tangent, but that stuff is important. It really does say a lot about what the state of I'll say the state of your economic area, but also your health, because it's said, and I think Oprah has like a documentary or something where she says it, but it's like it's well known in the public health sector, is that your zip code is one of the largest predictors of your health. It's not the stuff that actually happens when you go to the visit. It's literally where you live, where you work, and where you play. And most, like Dr. Jasel was saying, a lot of those nonprofits are hitting one of those areas, whether it's literacy, financial literacy, education, some type of empowerment, whatever the case may be. Like I meet people that's like work with caregivers, like in their mental health. I mean, it's like the lifespan of people, and these nonprofits are hitting something. And I don't think they really, when I said in a moment, it just came to me in a moment. Thank you, Lord. But it's something to be said. I think it needs to be said louder, because I think a lot of nonprofits don't realize how powerful their work is. Did you know that data-driven organizations are 19 times more profitable? 19 times. I know you like the way that sounds. And they also attract and retain customers better too. Well, if you want to see how close you are to being in that number, take the quiz. Head on over to mogulbeginnings.com/data into dollars quiz. You're listening to Cityscape Radio, where local vibes meet timeless tunes. Be sure to check out all the things Cityscape and Brownstone on brownstoneworldwide.com. We have tons of things happening. We have a cruise coming up. I mean, the sky's the limit. So head on over to brownstoneworldwide.com.
And I think part of that is we have to celebrate each other, because some people are doing it simply out of passion and out of the love. And just as we heard last week, the passion and the love, that's great. That's wonderful. And I'm never going to downplay it. But we have to be very strategic in the support of each other in our businesses, and working together, collaborating, not doing things in silos.
Yeah.
And then also just being very intentional with the growth of our nonprofits, the target demographic of our nonprofits, like who are we talking to?
Yeah.
And so doing our due diligence as nonprofit founders and CEOs and workers and volunteers to be able to deliver the message that the community actually wants to receive. And truthfully, I think that because on the research side, the academic side, because I am also a professor, I didn't say that before, but my research,
we know about you now. 45 other things.
my research has been centered in health equity. And so within the health equity and then translating that over to policy, we have to be very intentional about how we tell the story. And ultimately, nonprofits need to be skilled, extremely skilled at not just the data, but understanding the financial implications of what they're doing.
Yeah.
Because that is what gets politicians and policymakers to pay attention.
That's good. Yeah, I was just on a call with someone, and she was telling me about the work she's doing. And it's great. Like a lot of the nonprofit work is great. Like whether it's great on paper, you say it out loud, but when it's time, like you said, to talk to politicians, even get funding from these banking institutions or other large institutions, it's like some of the stuff that we do that we care about, it's just like, well, why should it, like, unless you really start talking about money or something that's really close to home to them, it's just like, well, why should I care? So being able to associate the economic impact is so powerful and so true. So I love that. And a big part of that is, using your data or whatever. But but no, that's so true. So I'm glad you mentioned that. So all my nonprofits out there, if you have not yet told your story in a way that's compelling, perhaps you want to integrate the economic impact of the work that you're doing. And you may not think it's that big of a deal, but trust me, it is. Even if you're educating students, those have big implications towards the jobs that they get, how much you're able to contribute back to society, criminal justice records that are averted. Like, it's so many different things that are rooted in what you guys are doing. So we just have to do a better job of telling the story and the economic impact.
Absolutely. Yes. 100%. And, one of the, good, and we can get into this a little bit later. I'm not sure what else we're going to talk about today, because you know how we just do when we get together. But I would advise all nonprofit owners, and even if you're doing anything in the community, get to know the people who are in your academic institutions who are doing translational research, CBPR, community-based participatory research, implementation science research. These are the buzzwords for the researchers who are going to be intentionally looking for people just like you. So just like you want to connect with them, they want to connect with you, because a huge part of the success of their research depends on partnership with people like you.
Mm-hmm. That's real, especially if you represent and serve Black and brown communities. A lot of research that don't look like us, they recognize that they can't just go into our communities anymore and do something. Like, they have to partner. So that community-based participatory research. Girl, I was talking to Kim O'Neill, and I was trying to find that phrase. I was like, community-based, and I knew participation was, I could not say it, but that's what I was talking about. But a lot of these organizations, they want to do research, but they know they can't do it alone. They don't know anybody in these communities. They can't just go in there, with this white savior complex. Like, they just can't. So, like, I love that you said that they need you just as much as you need them.
Mm-hmm. Yep. That's actually a project I'm working on right now.
Okay. So, look, we probably got time for one more question the way we going. But that's okay. I can have you back again.
Hey, whenever you're ready, sis, I'm here.
So, in your opinion, what is the value of using data when you're a nonprofit? Like, will it really impact their ability to get funding? Because I know that's a big thing. They're like, all right, Michele, you talking all this stuff. Where the money?
Mm-hmm. Yes. Long story short, absolutely yes. If you didn't take anything else from today, get to know data. Don't let it scare you. Mm-hmm. So first thing first, data can be qualitative or quantitative. So me, myself, I'm what's called a mixed methodologist. I do both. I like to tell the story. There's value in the story, especially when you get into the community and you are allowing the community to help drive the research initiative. A lot of times researchers, they honestly try to answer questions that are of zero or little interest to the community.
That's real. Listen, so, like me, you just trying to get that degree.
Girl, that's a whole other conversation. That's a whole separate podcast right there. I just want to defend this doggone dissertation and it not take 20 years, please. Thanks. Mm-hmm. Okay. So, that's that. But no, but for real, we really need your voice. And the way that we tell our stories is through data, whether it's through words or it's through numbers. And I truly believe that both of them together help create an impact that is so solid that it's irrefutable. You're looking at health outcomes. Okay, that's one thing. You're looking at the maybe ER readmissions for your area if you're health related. You're looking at the number of practitioners that are in your area that provide mental health services, or you're looking at the amount of substance use and abuse in your county or in a particular zip code. Whatever it is, that tells your story. That tells you why your services are relevant in the first place. So you need to do that regardless of how big you are, how small you are. This makes you compelling. This makes you can't say no to somebody who comes with their data and they know that. What can you say? What can you say?
Like, unless your mission just doesn't align with theirs, if you can tell that story, I mean, you a force. You are totally a force to be reckoned with. But I love what you said. Don't be afraid of it. And I feel like nonprofit leaders, as well as business owners, they have been afraid of it. It's just like, I made that joke during the conference, but it's so true. Like, oh, I was bad at math in like middle school. And it's just like now all of a sudden I don't touch it at all. I'm like, okay, let's get over that real quick. The math that you need is not algebra for the most part. Is a lot of times it's basic addition and subtraction. You allow the spreadsheet to do a lot of the calculations for you, but you need to understand what's going on in your business. And I think in your organization, like when I say business, I'm talking about both small business owners and nonprofits. You have to know what's going on in your business. And the reason why is because you're the owner, you're the CEO, you're the leader, you're in charge. So if you have all these things happening, these programs happening, you're doing this and you're doing that, but you don't know how much you're bringing in, you don't know if it's effective, you don't know how much it costs per child to run this program, how much it costs per lead, all this stuff, and you just doing stuff, you're gonna end up bankrupt or not having enough to pay your program coordinators or the people that actually run the program. Because it's like, well, I don't do that. Like and I know I'm probably exaggerating, but you do have some people that really do shy away so much and even trying to completely pass it off. It's okay to bring in someone like Dr. Jasel and myself into your business, but you cannot be totally hands off with what is happening in your business. You need to have a high level understanding of what's going on. So again, don't be afraid of it. Take it head on. Get somebody like me or Dr. Jasel to walk you through it, but you can't run from it. Okay. It's that if you run from it, your money, the funding will run from you. Okay.
I like that. That's real though. And so, I have a for-profit business as well. That's the entire reason I did my MBA, because I wanted to be responsible for the financial health of my business and know what's happening. And I think sometimes CEOs or founders are just like, oh, well, I don't know. That's not my area of expertise. Yes, but honestly, it kind of became your area of expertise when you took this on. And yes, it's a service. And yes, we are so proud of you for taking a step out on faith and doing all the things that God has told you to do. Yes, absolutely. But with that comes responsibilities. Absolutely. And so let's prepare you to handle the responsibilities appropriately. But you can't, just like, for those of you who have children who are just like, oh, but I didn't know. We talked about this last week. Nothing has changed this week. It's the same thing. You have to remember that, like Dr. Michele said, it influences your cost effectiveness. If you have staff, can you retain your staff? Can you pay them? It is imperative to your credibility. Yeah. And a lot of nonprofits fail, not just for these other things, but we don't really talk about it that much, but it's a lack of transparency. Yes, what are you truly doing with your money?
Because listen, people want to know now. It's so many people, girl, so many people going down for them PPP scams. They was taking money, buying stuff. And there is this negative stigma if I give my money to someone. And I mean, it's a current case going on right now, current debacle on social media with this whole fund. It was like a Black fund, real estate fund. And there's potential, and I believe it's substantial evidence of gross misuse of the money. And so that's out there. There's always going to be a stigma that you're taking my money, you're buying a boat, you're doing this. And you have to get ahead of it and show people like, no, we have these programs, we're impacting this, we pay this many people. Like, you have to get ahead of that narrative.
Mm-hmm. It's crazy. That PPP, I know, it's totally unrelated. As a business owner, like the first round, I didn't even qualify, quote unquote, because I did it the right way.
Mm-hmm.
And I'm like, I actually have a business and I actually made money. And I didn't qualify, but I know people who don't even have a business.
Didn't even have a business. They
out here getting coins, okay?
And some of them are going to jail right now. So, unfortunately. Anywho, before we run out of time, Dr. Jasel, because we're going to have to definitely have her back. I'm sure the listeners have enjoyed you. Child, we're going to have to make a part 2. We're going to make a part 2, y'all. But could you tell them a little bit about your nonprofit, and perhaps we can spend a little more time there next time?
Absolutely. Yes. So I do have a for-profit that's called the Viv Wellness Academy, but we'll leave that part alone for now. I am also the founder and the CEO of the Hilda Public Collaborative, where we connect and provide culturally relevant services and programs that integrate all 8 dimensions of well-being to improve chronic disease outcomes in communities of color. That is not just here in the Dallas-Fort Worth area, that is all over the country. I have a heart for the Washington, D.C. area, Baltimore area, Atlanta area. These are areas that literally gave me my start professionally. And I have not forgotten about you. I love you, Dallas-Fort Worth, your home. You will always be my number one. But right now, one of the biggest projects that I'm working on is a database that actually connects the community and nonprofit owners with clinicians, with policymakers who are interested in different areas, where you can literally just search. Hey, I'm looking for a researcher at UT Southwestern who does this. Boom. I'm looking for a nonprofit owner who focuses on recidivism. Boom. There you go. You have their contact information. You can connect right there. And so it helps bridge this gap, these silos, these information silos, and it helps you get your data. So
that's awesome. And since you were talking, go ahead and tell us how to find you so we can learn more about you, your nonprofit, or your for-profit.
Absolutely. So I tried to be kind of consistent with my handles, but you can find me on my website, drjaselmartin.com, JASELMARTIN, just in case you were wondering how to spell my name. On Instagram, Facebook, Twitter, and YouTube, I am Dr. Jazzy Fit. That's DRJAZZYFIT on all of my social media platforms.
I'm going to ask about this fit next time, because you know I teach Zumba, so we have to circle back. So we got so much more to talk about. We'll be like a part 7.
I didn't even know that about you.
I love to sing, but I also love to dance. So guys, thank you for joining us on this episode of Numbers Don't Lie on Cityscape Radio. I've been your host, Dr. Michele, and you can find me on all things Mogul Beginnings. That's MOGUL, Mogul Beginnings. That's Instagram, Facebook. I scroll a little bit on TikTok. I'm out there on Twitter, but alrighty guys, until next time, see ya.
Mogul Beginnings Data Consulting helps nonprofits and small businesses strategize, optimize, and scale by unleashing the power of their data. So if you're ready for your data to be unleashed to help your business tell beautiful stories, connect today by logging on to mogulbeginnings.com. That's mogulbeginnings.com.
Have you heard of an impact report? Perhaps you've only associated with large companies or large nonprofits, and you said, well, that's not for me. But let me tell you, it is for you. Let me give you a few reasons why you need to have an impact report done for your next fiscal year. 1, it shows all the hard work that you've done throughout the year, all the people that you've impacted, all the products and services that you have launched and distributed. You get to cheer yourself and your team on. 2, it shows credibility and transparency. You get to show your donors, supporters, and contributors what you're doing with the money that is coming to your organization, so they are confident that you are doing the work that you say you're going to do. And 3, you set the tone of what improvement should look like for the next year. You've shown what you can do this year, so you get to say, we can do this and more. So if you haven't tapped into the benefits of an impact report, now is a perfect time to start. Reach out to our team. We can't wait to talk to you soon. Head on over to mogulbeginnings.com now.